Hi everybody, Dr. Susan. I just wanted to make a quick video today. I was actually making another video a few minutes ago. I don't know what's going to happen with that one because my phone rang and it got interrupted and I don't know where I am with that, but there was a point I was making at the end of that video and I felt it was really important to get that out because I don't know what happened to that other video, but talking to a young girl this week, actually a couple of young girls, and that's the thing, it's like it's happening so much lately. It's incredible. But younger people are suffering so much in this world, and it's not being realized. And I just want to explain because I realized yesterday in talking about my story and going into detail that through my 20s I had a lot of anxiety. So I suffered from debilitating anxiety so much that I couldn't eat or sleep, where my doctor threatened to hospitalize me if I didn't eat something, because I think it was like 3 or 4 days I hadn't eaten or slept. So I used to stay up. I used to have panic disorder. No reason why. I would be panic stricken, and it was very misunderstood at the time. But medicine after medicine were prescribed to me. I'll tell you this. I always laugh because the medicines that got prescribed to me in my 20s, and this is 30 years ago, most of them now are lawsuits. So the purple pill is one of them. I'm trying to think. There's some that are off the market, some that are now black labeled. But I was giving them the prescriptions like it was nothing. However, I did not take any of them. So I'm so thankful that my mom raised me and she didn't have a medical mindset and we didn't take medications. So everything, was fixed naturally. And we didn't get sick often and had pretty uneventful childhood, thank God. But it made me think that, like, had I taken all that medicine, and then in my 30s, I was told I needed double knee replacement because I had swelling around my knees, around first my right knee, then my left knee, both knees was swollen so much that my son at the time was young and it would scare him. So I stopped wearing shorts because they were so deformed looking. It would scare him. So I wouldn't wear shorts anymore. In the summer, I wouldn't wear shorts because I had so much pain, so much swelling, could not walk up the steps, couldn't go on trips. We talked about Disney World, but it wasn't possible for me. I missed Boy Scout trips with my son because I couldn't walk. It's kind of sad. And it's happening so much now that I'm really starting to remember what I went through, just to connect with the patient. Like, I know what that feels like. But more importantly, it's the medication and the answers I was given that what I did not realize at the time when I was 37 and told I needed double knee replacement because my dad had arthritis in his knees. They told me it was genetic. So I need double knee replacement. I said no because you had to be off your feet at that time for, I don't know, like 6 months. It was crazy. I just didn't have the time for it. I was working. I had 3 young kids. Like, I couldn't do it. So that's why I was like, I can't deal with this right now. So what I did at that time at 37, that's when I got under really regimented chiropractic care to solve my problem with my knees, and it did. So chiropractic care fixed my knees. And learning about the body in chiropractic school later on, the anatomy of it, I totally see why the knees get inflamed or structural issues happen. What also was happening, now this is the most important part, I didn't realize from these swollen knees or swollen joints that I had autoimmunity in my body. So now I remember my story. When I was 40, I was diagnosed with MS, debilitated, fell overnight, debilitated. When I think back to these stories, I'm like, I didn't fall overnight. I had signs along the way. I just didn't know that they were signs of autoimmunity. So I had the swelling in my knees or joints. That's a sign of autoimmunity. The body's attacking the joints. For me, it attacked my brain, but it attacked my joints first. So you have to pay real careful attention to this stuff. The anxiety and panic I had in my 20s, but now I have patients who are being diagnosed with autoimmunity in their 20s. Usually it's fibromyalgia or something general in their 20s. And there's just so much more to it than that. And there's no medication for it. And now they say that over 95% of our country has autoimmune disease, undiagnosed autoimmune disease. That is scary. And you have to take these signs and symptoms seriously. And I always post this on my Facebook page because symptoms are not to be ignored. They're like sacred messengers from your body saying, help me, there's a problem here. Your body's screaming out to you to help me. So I talked to a 20-year-old and she's telling me she's in so much pain that she had to actually drop out of school for a semester. I hear things like this all the time. I'm like, what? You know, and they're giving her medication after medication after medication and all kinds of stuff. And you don't need any of that. And that's the issue. That's the problem today, is that we are just band-aiding, putting a band-aid over these symptoms of these poor young people and not paying attention to what's going on. That's what brought me, I said this, it was the end of the video when I was talking about toxemia, explained because detox is so important. Because if the cell membrane is inflamed, metabolic waste that's generated in a child or young adult's body every single day, the human body, you have 70 trillion cells and they make metabolic waste every single day. But if your cell membrane is inflamed because of poor eating habits or inflammatory fats, that metabolic waste is not going to get out of the cell. So they become toxic and they start experiencing all these symptoms. So we use the analogy here, their bucket is overflowing. So drop by drop, these buckets or cells are filled with these toxins from the time you're born. In young adults today, if you watch 10 Americans, it's going to show you that babies are being born today with their buckets full, not empty, that are being filled through life. They're already full and they start overflowing immediately. So I really caution you, especially if you're the mom of a young adult and they're having anxiety, fibromyalgia, swollen joints, pains, swollen small finger joints, things like that, allergies, food allergies, headaches, migraines, dizziness, lack of sleep, hormone issues, heavy periods if it's a girl. I can go on with the symptoms that are getting experienced today by these young adults, and parents are bringing them to the medical doctor and they're getting put on medications and another medication, and before you know it, they're on 6 medications. Well, what's going to happen down the road? Because that medicine is not healing anybody or anything. So down the road, all these medications are not going to work anymore, and they're going to have to get on stronger medications. And I talked to a physician's assistant about this. Actually, she came to one of my talks last year. She's like, I'm having to medicate patients so much. And she's like, it reaches a point where I can't add another medication or I can't up the dose anymore to help these people. So they start giving them heavy pain meds. And we all know that is not an answer and what that's leading to in this country. So I beg you, please research it. You don't have to take my word for it. I'm just saying, this is what I see. This is what I see every day. And you know, we were just talking yesterday, and like me and some other doctors, we were all born in this time. Like we're in this time right now. We have this information, so we have to get it out. We have to let you know because people are not hearing this. So that's why I've been making so many videos lately, because it's very important to me to reach out and help everybody with their root causes issues. And sometimes it's simple as a 90-day detox. Everybody needs it. Everybody, young, old, they need it. I detox kids as young as 3 years old. They need it too, because I just told you they're being born with their buckets full. They have a world of hurt in their path. So please help them. If you have any questions about any of this, please contact our office. I beg you, because it's so important. It's so vital to their health. These young adults, this is our next generation. It's so important that we take care of them and nurture them and explain to them the importance of food, the importance of eating, the importance of toxins, the importance of putting things on their skin that have toxins in it or are carcinogenic. We don't want them to develop cancer. But I'll tell you, 2 in 1 people right now are going to develop cancer. So what's it going to be in 10, 20 years from now? Just one? Everybody's going to have cancer? You better be sure you have a plan to not be the one to get the cancer. I always tell people this, I've been saying this for years, you better have a plan. Don't ignore it. Don't say, oh, it's not going to happen to me. Very likely chance it can happen to you. Very likely chance it can happen to me. But I'm working every day to make sure that does not happen. So I want to be the beacon of light to help you. And I had a beacon of light on my journey in 10 years, and I followed after that beacon of light and got me to health. So I want to be that to people also. I just want to pass on the blessing that I had. You know, I was very lucky to come back from debilitating MS and be perfectly fine today. It took me 10 years, but who cares? I'm not dead. This is my death year. This year I was supposed to be dead, or I should have been in a wheelchair 5 years ago. I'm not. I'm fine. So go hiking, up to 10 miles. It's not a big deal. It's so amazing. My energy is high. So I want the same for these young adults. I'm talking to children. I call them children again because my kids are this age. My kids are between ages of 22 and 26. So to me, I just call them kids. They're not. They're young adults. They're fantastic young adults. And I don't want them to be subjected to these ailments. That's what I'll call them. Just ailments or symptoms. They're symptoms, and they're just medicating the symptoms. They're taking the history, getting the symptoms, and medicating them. That's the medical model. I'm not knocking it. If you want that, that's your right way to go. But for some people, they don't want that. For a lot of young adults, they do not want that. They understand this is not the way to go. But the moms are pushing them that way. So I'm asking moms, mom to mom, please don't do that. Please find out. The functional blood chemistry analysis that we do here is amazing for recognizing that. We have another test, a simple test that lets us know the toxicity level in somebody. So I ask you, please just research and know, or call our office, and we'll let you know those other avenues that are available to you, okay? So please help take care of this generation. They just need it so badly. Okay.